So we talk about drug and vaccine administration to cattle. We always want to put that in the proper area. We do not want to give shots, whether that's a vaccine for respiratory disease, an antibiotic treatment, or even a hormone synchronization shot in this area of the loin and down the sirloin and the back straps of that particular cow, because these are high value cuts. We don't want to cause damage in that area. So we're going to put it up here in the neck muscle, because that area can be easily trimmed out on that carcass if the lesion does happen post-administration. So we're going to look to deliver that vaccine or drug in front of the shoulder blades, which you can pretty readily palpate on any of those cows, and then midway from the top of the neck to the bottom of the neck, and we want to avoid the jugular vein and carotid artery, which run in a groove down at the bottom of the neck. So that's the area we want to deliver. When I'm giving shots or vaccines, I'm usually giving with a one-handed method. So I'm going to draw my particular drug up in the syringe. I'm going to take the needle off, and I'm going to reach in one-handed and poke through the skin and go into the muscle or under the skin and deliver that drug and pull out. That way, I'm not placing my hand in the way and have the potential for poking myself with a drug in the arm or in the hand. If we're using an automatic dosing syringe, the method is the same way. So most of the vaccines and drugs you're going to give will have distinct label information on how you should give them. Most of them are intramuscular or subcutaneous. Some of them have very specific directions. One of those is the Exceed product, crystalline-free acid. This type of product has a cottonseed oil base. It needs to be put in the base of the ear in the cow. I'm going to show you how to do that. So to give a dose of Exceed or the other generic product of crystalline-free acid, we need to go deliver the base of the ear. So we're going to put a halter on the cow so we get the proper restraint. When we give Exceed shots, we want to give it in the base of the fat pad of the ear. So if we grab the cow's ear with the right hand and the left hand, we can palpate the fatty part of the ear. We're going to go straight in perpendicular with the needle with our drug, pull back to make sure there's no blood, and then deliver that Exceed product. So the reason that we give that product at the base of the ear is because if we were to deliver that Exceed product sub-Q or in the muscle of the neck, that cow would have a 285-day slaughter withdrawal. We don't want to do that. So we want to give it at the base of the ear. That product is designed to be removed at slaughter. So one of the first things that happens after this cow hits the slaughter floor, after she's rendered unconscious and exsanguinated, they're going to take her ears off and skin the head. So the product is going to be removed, and we don't have any residue risk if we put it in the base of the ear. Another place that we administer drugs in cows, and this is very important for drugs that need to be intravenous, like Banamine, which is labeled for intravenous administration, is the jugular vein. The jugular vein runs on both sides of the neck. It's about the size of a garden hose on a beef cow. Here you can see the jugular vein pulsing a little bit. That's normal, coming up from the heart. The blood flow runs from the base of the head all the way down into the chest. So to give an intravenous administration, all I'm going to do is hold off that vein. I want to block the blood flow so the vein blows up for me. So I'm going to hold that off. You can see this vein pop up. Then I'm going to take my finger and make that bounce. That tells me there's fluid, which is blood, inside that column of the vein. I'm going to poke my needle in and see we've got blood bouncing out, dropping out. That's what I want to see. Veins are low pressure. If we happen to get in the artery, which we don't want to be, the blood would actually shoot out quite a ways. We want to take that needle out and put it actually in the jugular vein. Then we can attach our syringe, deliver our medication, or take a blood sample if we need to, and then pull our needle out, and we're done.